Now, from the News Channel 5 network, this is Medical Mondays.
I'm Carrie Sharp. Thank you for joining us for Medical Monday. Our topic tonight, colon cancer awareness. It is Colon Cancer Awareness Month, so that's why we're talking about that tonight. It is your chance to get your questions answered by a doctor, and the doctor we have tonight, Dr. Susan Briley, here with us. Dr. Briley, thank you for being with us.
Thank you for having me.
You practice out at St. Thomas Midtown. We appreciate you spending the next hour with us to talk about this. Obviously, it's your life's work. This is very important to you. It can be a tough and sometimes uncomfortable topic, but it's one that we need to discuss. Can you kind of give me an overview of colon cancer?
Colorectal cancer is one of the 3 most common cancers. Fortunately, in some age groups, it's actually been decreasing, and deaths from colorectal cancer have been decreasing. Unfortunately, it's increasing in some younger groups, and I hope that we'll talk about that in a little bit. But the thing about colorectal cancer is that it is preventable. Not always, but part of the focus of Colorectal Cancer Awareness Month is that it's often preventable by screening.
So let's start there, because anytime you mention these screenings, people go, oh, especially having to drink all that stuff and have the colonoscopy. So let's just lay it out there. What is the screening all about? If people are over 50, what do they need to have in mind?
A colonoscopy. Now, the recommendations might change depending on your family history, because if you have a family history, then we recommend you get a colonoscopy 10 years before the age at which your parent or your sibling had colon cancer.
Gotcha.
So if your mother got it at age 52, then you should probably have a colonoscopy at age 42. Persons with inflammatory bowel disease, such as Crohn's disease or ulcerative colitis, are in a completely different high-risk category. And then there's some genetic syndromes. Lynch syndrome is a genetic mutation that accounts for about 6% of colorectal cancers these days. Wow. But if you're just a normal person with no family history and none of those risk factors, then you should have a screening colonoscopy at age 50.
And what does somebody need to expect if they're just coming up on that age 50 mark, or maybe have never done this? What should they expect going in?
Well, the worst part is the prep. Everybody, nobody really likes the prep, but it's a lot better than it used to be. It's a much lower volume. So a colonoscopy consists of an endoscopic exam. It's a video endoscope. It's a long scope that has a video chip, and we watch it on a monitor. So the process is that you get scheduled and you get your bowel prep. And the purpose of the prep is to clean out the inside of the colon so that we can see polyps and tumors. If we see a polyp, we can remove it, and that polyp is gone, because polyps can transform into colon cancer.
And so right there during the colonoscopy, you can take that out.
Right, and that's why colonoscopy is a better test than even a mammogram, because it can be not only a screening or diagnostic exam, but it can be therapeutic, so that we're actually getting rid of it. So the cleaner you are, the better chance we have of seeing polyps. If we see tumors already there, we do biopsies. Inflammation and some other more unusual conditions can be diagnosed.
How long does a colonoscopy take?
It depends on the length of your colon, but it might take 15 minutes or it might take an hour and a half.
Oh, wow.
But you're sedated.
Yeah.
Now, the whole sedation has changed a lot in the last 10 years. And even when I was in training, there was a colorectal surgeon who did all her colonoscopies completely awake. I've done a couple of them on patients who didn't want to be sedated. I don't recommend it. It can be done, but we've got the medicines to relax you. So these days, we usually have an anesthetist or anesthesiologist give you sedation through an IV, complete amnesia of the procedure. You shouldn't remember a thing. You shouldn't feel a thing. You have to have a driver to go home, but that's it.
And then you're good for how long once you've done this, if everything comes back okay?
If it's totally normal and you're of average risk, 10 years.
10 years. Mm-hmm. That's a good amount of time. Yeah.
Now, the PrEP is, a fairly high volume. Mm-hmm. You have to be on clear liquids for at least a day, and you have to drink this stuff. And yes, it gives you diarrhea, but the cleaner you are, the better chance we have of seeing polyps.
I've seen it. And a polyp doesn't necessarily, well, let me pause real quick before we go into polyps. If you have a question about colon cancer, about rectal cancers, now is the time to call. 615-737-PLUS is the number to call, or 7587. We have folks in the back ready to take your phone calls. The lines are open, I can tell you. So if you're thinking, well, I really haven't wanted to ask somebody in person about this, go ahead and give us a call. It's a great chance to get some free advice and maybe some life-saving advice. So let's get, as we do that, as we line up those calls, let's get back to this polyp business. You're obviously in search of polyps. A polyp does not mean someone has cancer, though.
That's correct. But polyps in the colon, the specific kind that we're looking for, tubular adenomas, do have the possibility of transforming and growing and becoming a cancer.
So if someone has polyps, is it safe to say they are more likely to get cancer, or can just average Joe, average Shane, you got polyps, it is what it is, and it's okay?
Well, if they're not removed, they can transform. And there are some syndromes called polyposis syndromes where people may have hundreds of polyps.
Wow.
And those people, on the average, if untreated, will develop colon cancer by age 45.
My goodness. My goodness. When it comes to colon cancer, obviously you said screening will pay off, and that's why we're seeing the declines in colon cancer in the over 50 category. But what about symptoms? Would we notice any other problems?
So now that moves us into diagnosis rather than just screening. Let me just emphasize that screening is for asymptomatic patients.
Okay.
And what are the symptoms? Bleeding. And we always worry about rectal bleeding. We can talk about that more in detail. A change in bowel habits. Someone, maybe they have a bowel movement every other day for all their life, and all of a sudden they're having 5 or 6 bowel movements a day. Conversely, someone who's had a daily bowel movement and now finds it painful to have a bowel movement even once every 4 or 5 days.
Wow.
Abdominal pain, cramps, nausea, vomiting, and weight loss. But except for the rectal bleeding, those other signs are really pretty late. That means that the tumor has gotten really pretty big.
Oh, that's not good. That's not good. Because in the early forms, this is very curable, right?
Yes.
Yeah, and that's where the screening, of course, pays off.
But if you haven't been screened, and then or even if you have been screened and you do have symptoms, you have to really be pretty aggressive about getting worked up for that.
Because, these symptoms could describe a lot of things.
Sure. And I've had many patients who have made an appointment because they have bleeding hemorrhoids and they have rectal cancer.
Wow.
And they may have even been told by a physician, oh, it's just hemorrhoids. Take this over-the-counter medication. But if you have rectal bleeding, you need to have it checked out.
And checked out by who? A specialized doctor?
Not necessarily. If you have a primary care physician who knows you very well and you go to them, I've got some rectal bleeding, a family physician should be able to look at you and do a rectal exam.
Okay.
You got to check it out. You can't
And then they would
get
be able
out
to say,
of there
no,
without,
that's not hemorrhoids. You don't have hemorrhoids.
Right. Now, there's many physicians out there who, that's
not
their
thing.
specialty is, doing high blood pressure and diabetes and heart disease. And I'm happy to see those patients and to do the good exam.
Okay. So you just got to make sure that you're covering all bases.
Yeah, you got to make sure somebody does it.
Okay, let's jump to the lines. Christina is on our first caller this evening. Christina, thank you for being with us. What is your question?
Oh, hi.
Hi there, go
I
ahead.
was calling about the camera colon pill. I missed my colon test. I'm 55 now. I never had it done. So I wanted to know, because I'm really kind of leery about getting a colonoscopy, so I was wondering if I can do the pill, and how effective is that?
Is this the pill that you take beforehand? You know better.
Yeah, I think you're talking about the one that's a little camera
Yes.
that takes video pictures as it goes down. That is not recommended for use for colon cancer because The colon screening, I'm sorry. The colon has these, we call them valves, but it's like being in a rat's maze, sort of, and the camera can't really see around those folds. Now, the camera pill is used for small intestinal tumors or bleeding that we can't figure out. But no, I'm afraid that the camera pill is not adequate for colon screening. However, there are some commercial products out there that are quite expensive. Your insurance may or may not pay for it, but it's a home test, and it combines testing the stool for blood and for tumor DNA. And basically, you put a complete stool specimen into the bucket and mail it back to the company.
Oh, okay.
So for people, you know, who just absolutely cannot stand the thought of a colonoscopy, that is available. Medicare does pay for it, but if commercial insurance usually does not pay for it. And if the test is positive, you have to have a colonoscopy anyway.
Okay.
To figure out where that abnormality is coming from.
All right, Christina, hopefully that answered your question. And before we go to break, when you have someone in your office who is sitting across from you saying, I don't want to do a colonoscopy, what do you tell them?
I just try and talk them through the process, and we talk about the prep, and my nurse Jean talks about the prep. We've had it. We know you can do it. We know it's kind of miserable, but it's just not that bad. And once the prep is done, everything else is easy. You know, the medications that we have now, you're not groggy, you wake up, you're ready to go, have a little lunch. And so I ask a person, you know, what is it that scares you about it? And, you know, some people have very specific fears. You know, I get nauseated if I drink stuff too fast. We can give you anti-nausea medicines. You can take your prep more slowly. And some people, really what they're afraid of is that we'll find something.
Yeah. They don't want to get the bad news.
Yeah. And
it's understandable.
So you just, it's such a good thing to do for yourself.
Okay, well, on that note, we're going to take a quick break. When we come back, more of your calls and questions. This is your chance to call in, get on the line, talk to Briley yourself if you have any questions. 615-737 plus is the number to call. Stay with us.
If you want to shed the fat and sculpt your body to get that slim, sexy look of your dreams, then you need to stop working out.
Say what?
And start rocking out with Rockin' Body, the fun new body makeover system that was created by fitness expert and Insanity creator Shaun T.
Rockin' Body combines dance and fitness in a fun new way so you can achieve insane weight loss.
I lost 30 pounds dancing.
Now you can tone and tighten your abs, shrink and shape your hips and thighs, and lift and firm your booty, all while you're just dancing.
I've lost 33 pounds. I feel sexy.
And now, for a limited time, the complete $80 Rockin' Body system is 75% off. That's right, Rockin' Body is only $19.95. We'll even upgrade you to express shipping free. Get the complete Rockin' Body system for only $19.95.
Call 1-800-307-0417 or order online at rockabody.com. 1-800-307-0417. Call now.
There's no single answer to securing your financial future. You need to look at it from every side. Get dependable advice you can count on every week with the Retirement Report on News Channel 5 Plus. Experts on finance, taxes, and the legal system are ready to answer your questions. Don't wait to make a plan for your money. The Retirement Report, Friday mornings at 8 and at these encore times on News Channel 5 Plus.
Oh, beautiful for spacious skies, for amber waves of grain, for purple mountain majesty above the
Welcome back to Medical Monday. Dr. Susan Briley here with me, talking about colon cancer awareness and colon and rectal cancers. If you have a question for her, go ahead and get on the line. 615-737-PLUS is the number to call. We have Celine on the line. Want to get right to Celine. Good evening. Thank you for calling in.
How are you?
Good.
Hello, how are you?
We're doing great. Go ahead with your question, Celine.
Thank you. I had a colonostomy almost exactly 8 years ago. It will be 8 years ago this year. And I was having blood sometimes, blood. We'll just leave it like that. I don't want to be too dirty. But anyway, I had a colonostomy, and I had it at Vanderbilt, and it was students because it was cheaper, and it wouldn't cost so much money. And the gentleman, I got to watch, and it was fun watching. I enjoyed every minute of it. I had saw Dr. Oz do his, and he had trouble, so I went and did mine. And his was nice and smooth and flat and looked great and, looked perfect. And mine looked like I-440, and I am not kidding. And the gentleman, when it was all over, said he had never seen anything so bad in his life. He said he had only seen one other person that had anything similar, and he said they were not as bad as mine. And I've had an aunt and an uncle both die of stomach cancer. And I have trouble eating pumpkin seeds, sesame seeds. I have trouble eating corn. Have eating cherries.
Did the doctor say? Did he say that you had diverticulosis?
Yes, ma'am.
Okay, so that's why it looked like potholes. I guess you're describing it.
Okay.
Yeah, that's a very common condition in Americans, diverticulosis. And not everybody with diverticulosis gets diverticulitis, which is an infection. Diverticulosis are these little pouches that develop along the colon, probably from low fiber, high meat, low vegetable diet. So it's very common, but it can get infected, and then it's diverticulitis. That's actually a whole nother show, but I do recommend for those patients that they get on a psyllium fiber product.
Okay.
That's Psyllium. It is not at all related to colorectal cancer. Now, sometimes some of the symptoms can overlap as far as the change in bowel habits and bleeding, but getting the colonoscopy was the right thing to do. And, there can be some symptoms with food intolerances. And if those other things happen that we were talking about, more bleeding, weight loss, severe diarrhea and constipation, sometimes we may have to repeat that colonoscopy for diagnostic purposes.
Celine opened the door, so I'm going to go there. What should the nice, perfect, healthy colon look like?
Orangey pink velvet with some folds.
What we see in those science books. Okay.
Yeah.
Okay. Interesting. All right, we have John on the line. John, thank you for calling in. What's your question tonight? John, you with us? Oh, I think we lost John at the right moment. Let's see. Let's go Joanne. Hi, Joanne.
Hi, hon.
Hi, go ahead with your question.
Well, I'm calling. I don't particularly have a question, but I want everyone to know my sister died of colon cancer. And for those who are afraid to take the test, don't be afraid, because you need to know what's going on so the doctors can possibly help you and not die from it. As far as being uncomfortable, it's like any procedure for a medical procedure. You're going to be uncomfortable, but it's not anything that's going to devastate you. I mean, you're able to drink broth, you're able to have Jell-O, you're able to have things. You get a little weak, and you're actually looking forward to the exam to get it over with so you can have something to eat. So please, you've got to go and have this exam.
Yeah, Joanne, thank you for calling with that word of warning.
Thank you so much for
I've had 3 because of my sister, and like I say, they're uncomfortable, but I wanted to know the answer. They found a couple polyps, and they were cut out, so I don't have, you know, and it's something you've got to do. Man, woman, you've got to do it. Don't be afraid of it. Just grit your teeth and do what you got to do, and it may save your life.
Yeah, very much so. Joanne, thank you for sharing that with us tonight. We appreciate it.
Okay, thank you. Bye-bye.
And just a reminder, as in Joanne's case, I mean, she's being very vigilant, but if a family member has been diagnosed, that increases your chances, right?
Yes. A family history of colorectal cancer does increase your risk, even if you don't have one of the genetic syndromes. So, as I mentioned before, get your first screening colonoscopy 10 years before. But if you had a parent or a sibling who had colon cancer even in their 60s or 70s, then we do like to increase the frequency and decrease the interval to 5 years.
Gotcha.
If it's a first degree relative. Not so much for aunts, uncles, and grandparents, unless there's, you know, a whole big family history, and that's, you know, that's a whole nother topic. But a first degree relative means that you're at increased risk.
Okay, let's jump back to the lines. We're getting some great questions and comments tonight. Beverly's on the line. Beverly, go ahead with your question.
Yes, how you all?
Great, thank you.
I had a colonoscopy about 4 or 5 years ago, and they did find some pollen, but I am scheduled to have another one next month, and I wanted to know, would you advise for me to have that done?
Absolutely. If you have a personal history of polyps, we make a recommendation based on when your previous scope was done, how many and what kind of polyps. So when I do a colonoscopy, and let's say it's the patient's first colonoscopy, and I find some polyps, we remove them, we send them to the pathology lab. It usually comes back within a week, and we look at the number and we look at the type, and then there's a table that we can refer to that guides us on the next colonoscopy. So if you just have 1 or 2 small polyps, then we'll say 5 years. If you have multiple polyps or a large polyp, which we call an advanced adenoma, then it might be 3 years. And sometimes we'll remove a very large polyp. You know, I'm not sure I got it all. You may need another colonoscopy in 3 months, 6 months, 1 year, 2 years, and that's something that you talk to your doctor about. But, you know, I have a little system where we notify the patient of when they will be due for their next colonoscopy, and then we have a recall list too. So if you move, let your doctor who did your endoscopy, your new address. We give patients copies of their report with pictures, and you need to keep that in a file with your other medical records, so that, you know, if the doctor forgets or moves away,
there's a baseline to go to.
Yeah, you've got that record.
Now, when you say a small polyp versus a large polyp, how large are we talking about? Can you give me a reference?
Well, over a centimeter, which is a centimeter's only about that big. So that's really still small, but to us it's large.
When it comes to polyps, that's large. Okay, we're going to take another quick break. I know that Linda and Seymour are both on the line, as well as a few other folks. So when we come back, we'll get right to your phone call. Stay with us.
This is a Storm 5 HD weather update. Sign up for Weather Call at newschannel5.com.
Storm 5 alert remains in effect for Middle Tennessee and Kentucky. We've got strong storms possible Monday afternoon and evening. Hail, damaging straight line wind, the primary threat, although an isolated tornado cannot be ruled out. Here is a look at the radar. It is lit up like a Christmas tree, and we will continue to see all of these colors, those deep reds that indicate strong storms throughout the evening hours. Temperatures across the southeast right now warmed dramatically today into the 70s. That only served to create more fuel for these thunderstorms. Here's a look at current conditions in Nashville. A reminder to you, this is updated on the hour. Overnight tonight, we drop into the upper 50s, 58 degrees for Nashville. We expect rain to begin to taper off during the overnight hours, but but a stray shower early Tuesday morning not out of the question. The roads will no doubt be thoroughly saturated from Monday afternoon storms. Patchy fog not out of the question. Bit of a break as we head into Tuesday, Wednesday with more storms on Thursday.
Tuesday on Talk of the Town, football great and actor Eddie George is here.
Fresh from a run on Broadway in the musical Chicago, the former Tennessee Titan is back on stage in Nashville.
Hear about his starring role in a classic play, A Raisin in the Sun.
Then we have 2 easy DIY projects that are perfect for your spring decor. We're making speckled eggs and a cute bird's nest to put them in.
Plus, Miss Daisy is planning ahead for your Easter dinner with a show-stopping coconut cake.
It's all coming your way Tuesday at 11 on Talk of the Town.
Why are you taking out life insurance policies on your clients?
How are we supposed to know which numbers to believe?
This has gone on for years. When do you go to the Attorney General and say, let's shut this place down?
If there's a perfectly logical explanation, why won't you give it to us?
That wasn't really accurate, was it? It's cheating the children.
You just don't see anything wrong with that. It seems like a nice kind of perk for the mayor.
Why did you take all the money from all those elderly people?
We're happy to call. We've made calls. No one's returning our call.
And why won't they fix it?
Is there anything you want to say, sir?
Welcome back to Medical Monday. I'm here with Dr. Susan Briley talking about colon cancer awareness and colon cancers and rectal cancers. If you have a question, go ahead and give us a call. We have a few callers lined up. Let's first talk to Linda on the line. Linda, thank you for your patience. What's your question tonight? Linda, are you with us?
Yes.
Okay, good. Go ahead.
If you have a pylori virus, should you have a colonoscopy?
Now, H. pylori is associated with ulcer disease in the stomach and the upper portion of the small intestine. And as far as I know, there's no relationship between H. pylori and colon cancer.
So then you would just follow the normal recommendation, right?
Right, screening at age 50 if you're at otherwise average risk.
Okay, Linda, thank you for calling in with your question. Let's hop on to Seymour. Seymour, what's your question tonight?
Hello, can you hear me?
Sure can. Go ahead.
Yeah, Seymour Butt here. I've had 3 colonoscopies before, and I was wondering what kind of screenings I would need to go through if I was passing blood in my stool. Nothing's really showed up before on my colonoscopies.
So when was your most recent colonoscopy?
Believe November. It was October, November 1.
Okay. Well, that would not come under the definition of screening. That would come under diagnosis. So if you're having persistent rectal bleeding and you had a colonoscopy and it was normal, then you need to go back to the doctor who did the colonoscopy and say, I understand the colonoscopy was normal, but I'm still having bleeding. Let's try and find the cause.
Okay, very good.
You can't just let it go, but
because that's not normal.
Yeah.
Right. Okay. Let's hop over to Kim. Kim's on the line. Thank you for being part of the show. Kim, what's your question tonight?
Yes, I have had quite a bit of rectal bleeding all my life, and I've had 3 different colonoscopies, and nothing ever become of them. The last one was about 3 or 4 years ago, and I was just wondering what causes so much rectal bleeding?
There are a number of things that can cause rectal bleeding other than rectal cancer, and it's good that you've had your colonoscopies to make sure that there's no colorectal cancer there. That being said, with this caller and the previous caller, you know, things can be missed. So that's why you need to go back to the person who did the colonoscopy or your primary care physician and say, you know, I understand it was normal, but I'm still having bleeding. It's still not explained.
Because it is not normal to have rectal bleeding.
Right. However, hemorrhoids are pretty common, and although, you know, I don't want people to ignore their rectal bleeding, say it's probably hemorrhoids, that might be the case with these 2 gentlemen. They could have hemorrhoids, and they may need to see a colorectal surgeon about the bleeding to say, hey, I had my colonoscopy, here's the report, I'm still having rectal bleeding, can you help me figure out what it is?
When that happens and someone walks into your office, what are the next 2 or 3 steps you take?
We talk about their bowel habits, their diet, Of course, I want to get a copy of that colonoscopy to make sure that they, in fact, did a good job, that there was no nothing obscured by a poor bowel prep. We do a general medical history. I find out about are there any other of those symptoms that are occurring, abdominal pain, change in bowel habits, weight loss, or is it just the rectal bleeding? Is there any rectal pain? Then, of course, we look at the other medicines they're on. So many people are on aspirin now to prevent strokes. People who are on, who have atrial fibrillation are on blood thinners. So we go through that. Then I do an exam. And I look at the bottom. I do an exam with my finger. And I have a little scope that I can put in that's very good at detecting hemorrhoids. And if I feel that the hemorrhoids are the cause of the bleeding, then we start treatment of the hemorrhoids. And that could be something as simple as psyllium fiber, rubber band ligation, surgery.
Okay, easy enough. Okay, that's a great question, Ken. Thank you for calling in. I do have actually, we'll go to Nancy real quick. We have Nancy on the phone. Nancy, are you with us?
Yes, I am.
Hi there. Go ahead with your question.
Okay, 10 years ago, I had 5 polyps removed. Okay, but since then, 5 years ago, I had another colon test. I was fine, no polyps. Now, when should I have another colon test?
That's controversial. I was hoping that wouldn't come up because that's
you
a
knew
tough
it would,
one.
Though. Yeah.
Yes. Personally, I would say 5 years that you should repeat it. Some insurance companies disagree with that. But let's say that your insurance company comes down on the 10-year side. Then in the intervening years, I would have your primary care physician check your stool for blood. There's the little fecal occult blood cards that are very old-fashioned, and they actually pick up too much stuff. They're overly sensitive, but having had 5 polyps at one time, I think you should have that test every year, and if it's positive, then your insurance will pay for a colonoscopy, and then you can make sure. But if it's negative, I think you can feel pretty good, but make sure that you do get that colonoscopy at 10 years.
Thank you.
Linda, thank you for being part of it. Nancy, thank you for being part of the show. I want to take a moment as we get other callers lined up. We do have some phone lines open. Just if you want to give us a call, do it now. You know, we've been talking about colon cancer, rectal cancer, and usually that is in an older generation.
Yes.
But there is a trend that has just developed or just been noticed that's very alarming, and it deals with 20 and 30-year-olds. Tell me about this.
We've noticed it for several years, but just this year there have been some stories in the media documenting the fact that people born after 1990 have a much increased risk of developing colorectal cancer, and it would be at a younger age as well. And a lot of this is rectal cancer rather than colon cancer. We don't know why. Is it from the diet, too much fat, not enough vegetables, exercise, obesity, smoking? Those are all things that are associated with colorectal cancer. But the numbers are still small, and we just really don't know. Even the articles that we read cannot pinpoint what that is from. The youngest patient I've taken care of was 26, but was a heavy smoker. I have another 32-year-old who's fit, thin, vegetarian, non-smoker, who developed rectal cancer. So we just don't know. But the take-home message is that even if you are young, if you have any of the symptoms that we've been talking about, rectal bleeding, anal or rectal pain, abdominal pain, change in bowel habits, weight loss, anemia, you got to get checked. And you know, one of the articles that I recommended to you had a case of a young woman who, the doctors just kept putting her off until she had stage 4 metastatic disease.
Which means it's spread.
Yes.
And she's okay now, but...
Yeah, she's not cured.
No, I mean, she's a 22-year-old, and she's gone through this, and she's got a long life ahead of her, we would hope.
And, I can't scope every single person I see that has one little drop of blood.
Right.
And that gets really difficult because everybody's seen a little bit of blood on the toilet paper. But if it's ongoing and, it just doesn't feel right, at least get a rectal exam. But again, I may not scope every single person.
But boy, you gotta be your advocate.
They keep coming back and they have further symptoms, then we're going to scope them.
Let's talk about the other risk factors. We've talked about some, but let's kind of hit them down the line. So if someone's just tuning in, the risk factors for colorectal cancer, what should people be watching out for?
Well, the risk factors that may predispose to the development of it are family history, a high fat, high red meat, grilled meat diet, low in vegetables, low in fiber, cigarette smoking, maybe heavy alcohol use. And those are risk factors. But, not every smoker gets colorectal cancer.
No.
Some of them get lung cancer. But those are the things that if you want to improve your overall health, quit smoking, lose weight, exercise, and eat a more plant-based diet.
And that should help you out in a whole host of different things.
That's good for breast cancer, heart disease, diabetes.
It seems like every doctor we have on Medical Monday says the exact same thing. So you're not going to go wrong by doing those things. What about when it comes to gender? Are men more predisposed to this? Women? Does it matter?
No.
No, not at all.
It's an equal opportunity killer.
Gotcha. But again, we should take home the message that screening works, and this is very curable if caught early.
Yes.
What happens when it's not?
When we diagnose a colon cancer, we do biopsies during the colonoscopy, and if we get that, when we get that result back, a lot of it depends on which anatomic location it is in the colon.
Okay.
The next step is usually some blood work and a CT scan, and that has multiple purposes, but really to look at the liver, because colorectal cancer tends to spread to the lymph nodes and then to the liver. So we like to look at the liver, and then we get a chest x-ray. If it's a small colon cancer that does not appear to have spread, then we schedule the patient for surgery, and we remove that section of the colon. And some people think, well, can't you just go in and scoop the cancer out? No.
Yeah.
You take out that section of the colon with the lymph nodes that serve that part of the colon.
Okay.
Then we send that to the lab, and then they look at it and they tell us if the lymph nodes are involved. If the lymph nodes are involved, then we may recommend chemotherapy. Now that's for colon cancer. If it's rectal cancer, that's a whole nother topic. We do MRIs, we do ultrasounds. Depending on the stage of the cancer, the patient may need preoperative chemotherapy, radiation, then surgery, then more chemotherapy. So
highly involved treatment.
Yes.
Highly involved. Okay, we're going to talk a little bit about more when we come back. Of course, taking your phone calls as well. The lines are open. 615-737-PLUS is the number to call. We're coming right back. Stay with us.
Tennessee, one of the most innovative and modern states for healthcare in the nation. At United Health Group, we're honored to provide high-quality care to more than 1 million Tennesseans and to equip doctors and nurses with data and insights that can help prevent and treat illness. More than 3,000 of us live here, serving our communities every day. Tennessee doesn't shy away from tough healthcare challenges, and neither do we. United Health Group, built for better health.
If you want to shed the fat and sculpt your body to get that slim, sexy look of your dreams, then you need to stop working out.
Say what?
and start rocking out with Rockin' Body, the fun new body makeover system that was created by fitness expert and Insanity creator Shaun T.
Rockin' Body combines dance and fitness in a fun new way so you can achieve insane weight loss.
I lost 30 pounds dancing.
Now you can tone and tighten your abs, shrink and shape your hips and thighs, and lift and firm your booty, all while you're just dancing.
I've lost 33 pounds. I feel sexy.
And now, for a limited time, the complete $80 Rockin' Body system is 75% off. That's right, Rockin' Body is only $19.95. We'll even upgrade you to express shipping free. Get the complete Rockin' Body system for only $19.95.
Call 1-800-307-0417 or order online at rockabody.com. 1-800-307-0417. Call now.
Oh, beautiful, for spacious skies, for amber waves of grain, for purple mountain majesty, above the fruited
Welcome back to Medical Monday. Getting lots of questions answered today about colorectal cancer. Dr. Susan Briley here, practices out of St. Thomas Midtown. If you want to look her up, we'll also be giving you the number to call at the end of the show. So have that pen and paper ready. We will give that number to you very shortly. As we get any calls lined up that you might have at home, go ahead and give a call now because our phone lines are open. Let's talk about the old colostomies. And people remember maybe a grandparent had a bag, and that can be kind of fearful. No one wants to live life like that.
And I think that's behind many people's fear of having a colonoscopy. If they're diagnosed with colon cancer, 50% of the people I see say, do I have to have a bag? Do I have to have a colostomy? And most of the time the answer is no. There are a few patients who have rectal cancers in a very low location or it's very advanced. That's a whole nother discussion, but occasionally it is required and occasionally it is permanent. Probably more frequently we see patients who have a cancer that needs to be treated with multimodality therapy, chemotherapy, radiation, surgery, and those patients may need a temporary ostomy, and when they're done with their therapy, then we can reverse it. So that should not be a reason not to get screened because it's really very uncommon. But for the patients out there who are going to have ostomies or who already do, the appliances we have these days with the adhesives and the plastics are really mighty fine.
Really? Lots changed.
Yeah, it's not like it used to be.
Okay.
That is some good news. It's a very livable situation. And there may be physicians out there. There is a pro football player who had a stoma. He was a place kicker. Dentists, nurses, professional golfers. And there's a rap singer too. I've got a picture of him somewhere.
So completely normal people living with this and doing just fine.
Yes.
Into that story. Okay, let's jump back to the lines. We have Jan on the line. Jan, thanks for being part of the show. What's your question tonight?
I want to know if you got colon cancer and you go with it untreated, how long you can live with it, and then all of a sudden you got diarrhea 3 or 4 times a day.
That's a very difficult question to answer. I guess my question is, why would you want to go untreated, or why would you not get treatment? Because eventually it is going to be fatal. I mean, that's a very serious situation. You know, every cancer is different, and some are very fast growing and aggressive, and some are very indolent and slow growing, but you don't know that unless you don't treat it.
And your word of warning always, get the screening before you would ever have cancer.
Right.
Get ahead of it.
Yeah.
Right.
And if you do have symptoms, have a diagnostic exam.
Okay. The normal screening, if you're not at risk, if you know, have it at 50, wait another 10 years if all went well, does that indicate that that colon cancer is typically a slow progressing cancer, or should I not read it like that?
No, because every tumor is different. Some are very aggressive and rapidly growing. I mean, we tend to think that from polyp to cancer is just a few years. But that's very unpredictable. I mean, I've seen people who said, well, I had my screening 4 years ago and now they have an advanced cancer, but they had symptoms
in the meantime,
didn't get it checked out.
Right, right. So even if you've had that screening even a year ago or so, and then all these symptoms pop up, it's time to go speak to a doctor.
Yes.
We haven't talked much about rectal cancer this evening. What can you tell me about that? What do people need to be aware of?
Same symptoms, but there may be more of a sense of pressure with a rectal cancer, and it's a symptom where the patient feels they need to go, but they're not successful, and they still have this feeling of fullness. That's a late sign. But again, rectal bleeding, and you know, that's a pretty easy test that I described before in the office, a rectal exam. And make sure your doctor does it.
Yeah. Now, when men get their prostate exam, hopefully on a yearly basis or whatever that's called for, I don't know the exact requirements. Would that kind of cover that too? Or
it should.
Okay.
I've seen
you
it,
said that with some hesitance.
Okay. I've seen patients who had their prostate examined. It's on one side, and they got to go all the way around.
Gotcha.
I know. I hate to be graphic, but
it's
that's
the things that we should know. We have to know these things about our body. If no one tells us, I didn't go to medical school.
And you know, patients on whom I do a rectal exam say, well, did you feel my prostate? And I say, yes.
Yeah.
And if I skipped over that, then I say, nope, I have to go back and do that if you
want
me to check that today.
Okay, very good. Let's hop back to the lines. Darlene is waiting for us. Darlene, what's your question?
Yes, I just have a question. Like each time I go to the bathroom, like if I have a bowel movement and I would wipe and I would see a little blood, it was very light, nothing really heavy, but it went on for like 2 weeks, and sometimes I still see it from time to time. And I have made an appointment for, you know, a colonoscopy, and I had a rectal exam and everything came out, you know, clear, and a pap smear and everything was normal, but I was still a little, you know, worried about that.
Anything else that she should be concerned about?
Well, if there's ongoing rectal bleeding, it could be hemorrhoids, it could be an anal fissure, it could be anal skin tags, but that's where a good examination by either your primary physician or colorectal surgeon or gastroenterologist should be able to help. And, you know, I see people who've had a normal colonoscopy, I look, I don't find anything, and I say, look, when you have this bleeding again, call and let's get you in, let me examine you. Because there could be subtle tears that can cause a little bit of bleeding.
Would you do anything for that? Is it just to heal on your own?
Put the patient on psyllium fiber, as I've mentioned before, and just kind of see what happens. And, you know, you have to kind of keep pushing and going back, because honestly, we kind of feel and maybe get fooled if the patient didn't come back, they must be better.
Right.
And so that's our assumption, and that may or may not be true.
Should everybody be taking the psyllium fiber? Because you've mentioned it several times, so I want to know.
I don't have stock in it.
No, I'm not saying it for that, but if it's something that we should take as a preventative, it's something that's just good for our body, I want to know about it.
Well,
what's your
it
thought?
doesn't hurt.
Yeah. And just can help the system stay healthy?
Yeah.
Yeah. Okay, so there you go. Little health news for you tonight. A lot of health news
But
for you
then
tonight.
I'll have fewer patients to see.
Well, that's okay too
hemorrhoids.
sometimes. Yeah, that's true. That's true. What, as people come into your office just for a regular exam, what should they expect?
We talked about the history and then the physical, feeling the abdomen for masses and, heart and lungs if it's indicated for a more serious problem. And then I have patients lay on their left side. I have a light and I look around and then I do the rectal exam.
And this all takes about how long?
I'm pretty fast once I get in there. The exam takes just a few minutes.
Wow.
Or very few minutes.
Okay. I think, as I go to the doctor, I like to know what's coming. So I think if people know ahead of time, it may ease some anxiety, right?
Yeah.
I mean, I'm sure you've experienced that.
And a lot of people think I'm going to put them up in stirrups, like the gynecologist. Men assume some very interesting positions.
I'm sure.
But I just put the patient on their left side and...
These are all good things to know. These are all good things to know. Let's talk a little bit about the big C word, cancer, and let's just, if someone is diagnosed with cancer thanks to a colonoscopy, what can they expect next? Are we talking the whole thing of chemo, radiation? Is that a given, or does it depend on the stage?
It depends on the stage. We talked about the CT scan and the chest x-ray and the lab work, do the surgery. Cancers are staged 1, 2, 3, 4. Stage 1 colon cancer means that it's just on the inside lining. Stage 2 means it's going into the wall. Stage 3 means it's into the lymph nodes. And stage 4 means it's gone other places.
And when you hit stage 4, what are your chances, I guess? Everyone wants to know.
That has changed so much over the past few years. I have a few patients who have had stage 4 disease for several years. And if you had asked me that the first time I was on this show, I would say it is completely incurable. You have 2 years to live. And that is not true anymore because of the chemotherapy agents. But that's a whole discussion for the oncologist because stage 4 is not good and it's not usually curable, but it is treatable. Stage 3 colon cancer, we do recommend chemotherapy. Stage 2, it depends on the type of tumor it is. And stage 1 is almost always cured, not always, but usually cured by surgery alone.
Okay, good to know. We're going to take another quick break. This is when I need you to get that pen and paper ready. We're going to have the way that you can contact Dr. Briley if you have questions, want to get an appointment. We'll have that right after the break, so stay with us.
This is a Storm 5 HD weather update. Sign up for Weather Call at newschannel5.com.
Storm 5 alert remains in effect for Middle Tennessee and Kentucky. We've got strong storms possible Monday afternoon and evening. Hail, damaging straight line wind, the primary threat, although an isolated tornado cannot be ruled out. Here is a look at the radar. It is lit up like a Christmas tree, and we will continue to see all of these colors, those deep reds that indicate strong storms throughout the evening hours. Temperatures across the southeast right now warmed dramatically today into the 70s. That only served to create more fuel for these thunderstorms. Here's a look at current conditions in Nashville. A reminder to you, this is updated on the hour. Overnight tonight, we drop into the upper 50s, 58 degrees for Nashville. We expect rain to begin to taper off during the overnight hours, but a stray shower early Tuesday morning not out of the question. The roads will no doubt be thoroughly saturated from Monday afternoon storms. Patchy fog not out of the question. Bit of a break as we head into Tuesday, Wednesday with more storms on Thursday.
The Leukemia and Lymphoma Society is focused on curing blood cancers. You can help us find those cures by getting involved, having fun, teaming up with family and friends, and by joining one of our fundraising campaigns. Train with Team in Training. Walk to light the night. Sail with the Leukemia Cup Regatta. Become a man or woman of the year, or a student that saves lives. Get involved. Because when you do, you're not only helping blood cancer patients survive, you're helping them live. Join us and help us make someday today.
thank you for being with us here on Medical Monday, talking about colon and rectal cancer and just being aware of the symptoms and the screening that's available to help prevent having to deal with the cancer word in the diagnosis. Again, if someone is 50, what do they need to do?
They need to have their screening colonoscopy.
And how often?
Every 10 years, if it's totally normal. If there are polyps, it depends on the number and type of polyps.
And if someone is having certain symptoms, they need to go now. What are those symptoms?
Bleeding, change in bowel habits, anal pain, rectal pain, abdominal pain, unexpected weight loss, bleeding, or anemia.
And that can be for any age, just like we talked about, even as young as 20-something.
Yes.
You need to keep being your own advocate and asking those questions until you get answers.
Yes.
Dr. Briley, thank you for being with us tonight.
Thank you.
A wealth of information on a topic that sometimes people don't like to talk about. So we appreciate your straightforwardness and all the answers you've given us.
Thank you.
And if you want to contact Dr. Briley, here's the number to do so, 615-986-6033, or go to advancedhealthmedicalmondays.com. You can also send the email. Again, thanks for being with us on Medical Monday. We will see you again next week.